About 1 in 3 women who experience violence, be it physical, psychological, sexual, by their partner at some point within their lifetime. Intimate partner violence describes actual or threatened physical, psychological, sexual harm by a current partner, a spouse, or a former partner. About 2 to 4 out of every 10 women will experience intimate partner violence at some point within their lifetime. Intimate partner violence is not just a thing of women. Men do experience intimate partner violence as well. However, women are more commonly affected by intimate partner violence. It is a serious public health concern. However, it's usually underdiagnosed because the abused or people in abusive relationships tend to conceal this because of stigma or privacy and security concerns within their relationship. However, there are certain pointers to identify people who are in abusive relationships. I want to focus this video on women who are in abusive relationships. Certain findings could point to women being in abusive relationships: frequent emergency room visits, missed appointments, unexplained injuries. Starting for women who are pregnant in abusive relationships, they tend to start antenatal care late. Like I said before, intimate partner violence is a serious public health concern because not only does it result in physical, psychological, or sexual harm, but it has a big role to play in onward transmission of HIV infection. There is a direct relationship between women who are in abusive relationships and the incidence of HIV infection. This is because women who are in abusive relationships have reduced negotiating power to use condoms. There is risk of forceful penetration, there is risk of genital inflammation, and there is a risk of presence of other sexually transmissible infections, which increase the risk of transmission of HIV infection. Women who are in abusive relationships do not seek healthcare as often as they should. Why? Because the partners do not want them to seek care in order to conceal the findings. This therefore means that women who are in abusive relationships tend not to uptake prevention of mother-to-child transmission of HIV because, 1, they start antenatal care late. 2, the abusive partners don't want them to engage in healthcare services because they will be found out. This has a negative effect on the children. Why? Because non-uptake of prevention of mother-to-child transmission of HIV increases the likelihood of vertical transmission of HIV, that's a mother-to-child transmission of HIV, giving rise to an increase in the incidence of pediatric HIV infections. And the key question is, why remain in an abusive relationship? Well, it's by choice, but however, certain socioeconomic factors like poverty, socioeconomic insecurity, social norms of femininity and masculinity are some of the drivers of intimate partner violence. Women who are in abusive relationships are at increased risk of psychosocial stress such as anxiety, depression, post-traumatic stress disorder, eating disorder, and panic disorders, panic attacks. Men who abuse their partners tend to engage themselves in binge drinking, purchase of sex. They have a lower likelihood to test and get initiated for treatment of HIV, and as a result, there is increased risk of transmitting the virus to their sexual partner. Therefore, intimate partner violence is not just a problem within the relationship, within those affected in a relationship. It is a public health problem. And it's important to be able to identify people who are in abusive relationships because they need help. Let's stand together and reduce the prevalence of intimate partner violence. If you found this video helpful, why not give me a like, follow me, and stay tuned for more videos like this. Thank you.